everyone again. We are going to be talking about a completely different topic right now on breast cancer and how functional medicine can help. We are Dr. Jennifer Simmons is going to join me in 1 second, and she is going to talk about how functional medicine is helpful for use of breast cancer, and that's what we are going to talk about with Dr. Jennifer Simmons. Dr. Simmons is a board certified functional medicine doctor. There you are.
Hi.
Hi. We figured it out.
Yes.
So
yes, the technology didn't get the better of me today.
That's great. That's great. Yeah. So thank you so much, Dr. Jennifer Simmons. She is a board certified functional medicine doctor who specializes in cancer care. And we are going to talk about importance of functional medicine, why functional medicine versus conventional medicine if someone is suffering from breast cancer. So let's get started. Dr. Jennifer, thank you so much for being with us.
Oh my God, I'm so delighted to be here. So delighted to be here. So, the functional medicine story is really just evolving, right? But the funny thing about it is that functional medicine is really getting back to the evolution of time. It's getting back to a place where our bodies functioned ideally. And what's so interesting is that in the area of cancer, the formation of cancer actually is just an evolutionary process. It's just our normal cells trying to navigate this new environment.
That's very simple. The way you explained it's very simple.
And that's all it is, these are our cells that are meant to live in a certain environment. And we've created this new, unwelcoming, unfriendly environment for it. And they're just trying to survive. So cancer itself is just an adaptation, a normal adaptation to an abnormal environment. And so, the traditional medical system, they see a cancer, and the only thing that they're taught to do, and it's not their fault. This is what they're taught to do. It's what I was taught to do. I was a breast surgeon for 17 years. And I thought, I was doing a really great service. I was cutting it out, not realizing that I wasn't changing anything. So, the traditional medical establishment sees a cancer cell and thinks, kill, kill, kill. And what do? We kill with poison.
Chemotherapy. Yeah, exactly.
It's either chemotherapy, so we kill with poison, or radiation therapy, we kill by burning, or surgery, we kill with cold steel. And all the while, the reason the cancer is there is because the environment is abnormal.
Wow.
And we're adding more poison to an already abnormal environment. So what's going to happen to the host? The host is just going to continue to get sick.
That's right. And everything, it makes complete sense. Why cancer survivors, they have all these issues about, fatigue and brain fog and all these issues, right? We hear about.
So unless you do something to fundamentally change that environment, then you're not really improving anyone's health. So my approach, and I talk about this a lot especially in my group programming, is that the first week when everyone comes, I say, we can talk about cancer this week, because I want to teach you about what cancer actually is. I want to teach you about why you have cancer. And then we're not going to talk about that anymore. Because I don't want to focus on the disease. The disease doesn't deserve our attention. What I want to focus on is health and building health. Because when you change that environment from the environment of stress, from the environment of stress chemistry, from the environment of sickness, if you will, to change the conversation to building health, to changing that chemistry from the chemistry of stress to the chemistry of health. When you do all of that, that's when disease goes away. Those cells don't need to mutate. anymore. They're happy. So what I do, what I think most functional medicine doctors do, is we help people to build a joyous environment.
Yeah, and absolutely. Yes.
Sometimes it takes, getting the heavy metals out. Sometimes it takes getting the yeast out. Sometimes, there are lots of stealth infections. I have corona right now.
Oh my God.
Yeah, it's okay. So, sometimes we have things in our environment that we need to remove in order to get to that place of health. But health can be achieved by anyone at any age, at any stage. And this is the work that you need to do it. You need to create the chemistry of joy.
I think it's very powerful. What you just said is so powerful. So let's talk a little bit about, like, a lot of people don't know what you're saying, and that's the problem. People do not, not only breast cancer, but any, now people are going through chemotherapy. So they already have cancer. So how do they, when they come to you, can you help them avoid the chemotherapy, or it's after the fact? How does this whole functional medicine come into play? Like, you do the test, and what happens?
So, this is a slippery slope, right? Because the traditional medical establishment, which is what I have my degree from, right? My name has an MD behind it. And so with that MD behind it comes a lot of expectations. So I am not telling people to not have chemotherapy, because I think that that's irresponsible of me. At that point, at the point at which they've already developed cancer, and they're at the point, because we don't give chemotherapy to everyone. So they're at the point where they have qualified, for lack of a better word, for chemotherapy, right? There's been some kind of formal determination that they would benefit from chemotherapy, although I'll argue that there's very little benefit for anyone from chemotherapy, but that's a conversation for another day.
Completely.
So they've qualified for chemotherapy. At that point, the sink is overflowing. You can mop it up, and you have to mop it up because the sink is overflowing. So, chemotherapy is that mop. You're getting that mop out to try to just control what's going on. My job with these people is to unclog that sink, right?
Got it. Why is the flow is,
So I'm working with them, they're going to get the chemotherapy. They're going to get that floor mopped up. I'm working with them so the sink stops overflowing. So for someone who is actively in chemotherapy, there are things that you can do from a functional perspective that makes that chemotherapy far more effective on the cancer cells and far less effective on the normal cells. So you can decrease symptoms, you can decrease side effects. I have patients go through chemotherapy feeling good.
Oh my God.
Which is like unheard of. But if you do things, and there are things that you can do, if you do things to protect the normal cells against the effects of chemotherapy, and you do things to make those cancer cells vulnerable, it's a totally different experience. So you go from all comers getting maybe a 20% of them getting some benefit from chemotherapy, and you change that benefit to like 80 to 90%. It's a huge difference.
Absolutely.
Right? And those drugs are toxic and poison. So if you're going to go through that process, if you're going to go through that time and give into that time, you ought to make it worth your while.
Absolutely. Yes.
Yeah. So I don't tell people not to get chemotherapy. Now, if they tell me that they're refusing to get chemotherapy, you know what? I'm not going to advise them otherwise. I'm not peddling it. I'm not denying it. But I am supporting people through it in a way that is not happening in any of the medical oncology suites anywhere.
That absolutely. So let's talk about like do you do different? What is your prescription on a very high level for an average user who's listening to us?
Yeah.
So do you all do this? You start with the testing. I mean, let's just walk through what are the overall type of steps that you do.
I'm very old fashioned. I start with talking to people.
Okay, that's good. Talking is good.
We have somewhere between a 90 and a 120-minute conversation.
Wow.
And I'm learning about every single thing that happened to them, not just from a health perspective, because so many people don't consider the things that go into a diagnosis, because everything that happens around you is going to change your chemistry. And as we said in the beginning, cancer is just an adaptation to a change in your chemistry. So, you know, people don't think about it, but they turn up with a breast cancer diagnosis or a colon cancer diagnosis about 6 months after something else major happened in their life.
Oh my God, like trauma or something?
They lost a job. They lost they got a divorce. They lost a spouse or a parent, or God forbid, a child, or there was some major change that led to a shift in the chemistry. And 6 months later, we have a breast cancer. And people don't think about that. They don't realize that.
Yeah.
And if you never deal with that, if you never deal with what the shift came from, then you're never getting back. And what we need to do, what our work together is to create that chemistry, to reset that chemistry to the chemistry of joy that your body does not need to respond with immortality.
Yeah.
And that's all cancer is. It's like, I want to survive. And you're giving me this environment. This is the only way I know how to do it. So, you know, we kick these primitive mechanisms into place when we change our chemistry. So I do a deep dive into people's history to see, you know, where do we need to intervene? Now, sometimes it's trauma. Sometimes it's just the way that they're perceiving the stressors in their life. Because stress itself isn't real. Stress is whatever meaning we give to it. And that's a choice. We can choose to give that meaning. And so, you know, I say to people, you need to think about stressors like you're the host of a party, right? And so as the host, you're going to go around, you're going to say hello, you're going to acknowledge everyone. But then you have to get back to being the host of the party. You can't stay there and linger in any one place because it's going to hurt everything else. So, you know, when you have stressors in your life, you can just say, you know, thank you for coming. Thank you for sharing. And get rid of that. It doesn't have to have more meaning than that. And so we do need to compartmentalize these things in a way that suits our health. And the internalization of stress and the physical meaning that we're giving to it is what's leading to all of this disease. And I actually have grave concerns about the breast cancer rates that are going to come out of COVID? This time.
Yeah. Because you're absolutely right. I mean, how we think manifests into our physical health. So what you're saying is that, you know, even you look at some of the older, like Ayurveda or acupuncture, they talk about mind, body, and soul. You know, the same principle that you're talking about. It's not just the body; it's everything together.
Of course, of course. And that's why, you know, I feel like functional medicine is the medicine of old. So it's this whole irony that like everything's old, that's old is new again. Right? So, you know, we're talking about functional medicine like it's some novel thing, but the truth is that, you know, the Aristotle knew food was medicine. I mean, everyone knew food was medicine.
But and we somehow forgot about it. I don't know what happened. We forgot about it.
We got too big for our britches. We got too sophisticated. We tried to make it harder than it is. Right?
Yeah, it's I love the way you said that you spend 90 minutes. I mean, we are all going used to going to doctors and 7 minutes or 5 minutes of empty time, and all of us, not only me, we just don't feel the satisfaction of going to a doctor and they just spend 5 minutes and give you a prescription or medication out. So and that's the culture we all of us have experienced for the last so many years. So after your 90 minutes, then your prescription is like clearing the mind and the body together.
So what happens is that not only do I spend that 90 minutes really talking to people and eliciting a story, if you will. So then I have them fill out a barrage of forms, which takes them a whole other probably hour at least to do. Okay. And from those forms, I am able to kind of narrow down into the areas that really need a deep dive, a deeper look. And, am I looking for toxins? Because these forms will tell me that. Yeah. Are you struggling with your liver function? Because if you're struggling with your liver function, and this is beyond, getting a blood test that says your liver function is fine, because your liver has to be failing in order for those tests to be abnormal. Okay. I'm not looking for failure. I'm looking for, I want you to be your best. Right? So if you're just mediocre, that's not what I want for you. I want you to be functioning at your best. So I'm looking at these subtle nuances to say, like, is your liver working as it should? Are you able to get rid of your toxins? And do you have toxins specifically that we should be looking for? Am I worried about mercury? Am I worried about aluminum? Am I worried about arsenic? And I'll know that from the foods that you eat, from certain characteristics that are developing. How's your skin? How are your nails? How's your tongue? How's your mouth? How's your gut? And I learn about all of this, and I am able to hone in, and we use very different testing in functional medicine. We are looking for the actual function of these organs and the subtle things that make a difference. But we also understand that this is all one system.
That's right. Not compartmentalized the way.
Yes. So we're not compartmentalizing, which is not to say that I'm a specialist in every area. But what I am is I'm a great generalist. And that's what we need. That's what we all need to be. We need to stop looking at the individual organs and start looking at the body as a whole. And that includes the mind, that includes the spirit. Because if one thing is out of balance, then your system is not going to work correctly, and you're not going to have what you need to be your best self. And like I said in the beginning, I help people to build health. So they have a treatment plan. They have a medical oncologist and they have a treatment plan. I'm helping them to build a health plan.
That's right. So what are the key building blocks? Like, is it, of course, diet, your, mental health?
Yep. So it's a lot of diet, but not only do we talk about diet, we talk about nourishment. And the distinction I'm making here is that there's primary food and there's secondary food. And it's the secondary food that you put in your mouth. Primary food, the thing that really nourishes us, is all the other things that we take in throughout our day, throughout our life, that bring us joy. So, like, I'll just give the example of what happens when you smell the head of a baby. You're flooded with joy, right?
That's right.
You're flooded with oxytocin, that chemical of love, right? So when I work with all of my patients, that's the one question that I want everyone to answer for themselves is what causes you to release that oxytocin? what is your primary food that brings you joy and makes you happy? And I want you to find out how to get that into your day every day. Find something that is going to bring you joy every single day, because it's super hard to be miserable when you're taking in joy.
Yes.
Right?
Yes.
And so we talk about food, but we talk more about nourishment.
Okay.
We also talk about having proper movement in your life. And that is going to have different meaning for everyone. But everyone finding their way to be active is super important, because your body is one of those things that if you don't use it, you lose it.
That's right. That's right.
So making sure that you are living an active lifestyle, because after all, we are all meant to cross the desert. We're all meant to be able to do these things.
Yes.
This was what we are built for. And just backing up, I talk about as much about not eating as I do about eating. Because we all need to be fasting. Every religion has fasting built in.
Yes.
Why? Because we need to fast. It's what preserves our health. It's what allows us to heal.
That's right.
So we talk about nourishment. We talk about fasting. We talk about movement. We talk about mindfulness, about having those tools in your toolbox in order to allow you to deal with the stressors of life, in order to allow you to have the strength and fortitude to give things meaning that should have meaning, and not to give things meaning that shouldn't. Right?
Yes. Yes.
We talk a lot about toxins, because we are living in a pretty toxic world, and it's impossible to avoid everything. Yeah. But there are a lot of things that you can do to both avoid what's coming in, but increase your own inherent detoxification capability. And I think everyone should know how to do that. I think that's a really important skill. Yeah. And so, we talk a lot about those things, and we talk about sleep, because sleep is where the healing happens.
Yes.
And this is a society that has largely devalued sleep. We think about sleep being for the lazy and for the unworthy, and it's actually our lack of value of sleep that has largely gotten us into the health predicament that we're in today. Yeah. And then lastly, we talk a lot about social connection. Yes. We are connected beings. Human beings need connection. Babies in isolation, they die. We cannot. And especially with this virus, we talk about social distancing, and this is exactly the poison that our country needed to tip the scales. And I think that we have to really consciously make an effort to stop using that term. That physical distance may be important, but social distance is a killer for all of us. Yeah, social distance is suicide.
Why did they come up with social distancing? Physical distance, 6 feet back, and you can meet people, and now everyone's so scared to meet anyone.
And that's what it is. It has created this concept and this society of fear, which is so dangerous. So dangerous. And you can actually feel it. You can feel, when you're afraid and you get butterflies in your stomach, that's something that's very real. You're changing your chemistry.
Yeah.
You're changing your chemistry. And that's exactly what we want to get away from. Exactly what we want to get away from. So I don't use the term social distancing. I highly discourage the term social distancing. Physical distancing, fine. But I want everyone not only to maintain those social connections, I want you to build more.
Yes.
I want you to build more. This needs to be a time when you get closer to people, not further away.
You're absolutely, I mean, yes, absolutely right. Because we, over the last few years, all of us, have been running for materialism, more material wealth. And we're trying to find joy from that, buying a big car or a big house or jewelry or what have you. And that's, I mean, for some, it's okay. I'm not saying that's bad, but we have not been paying attention to so many important things that are the fundamental and building blocks of our, good health.
Yep. And you think about it at these times.
Yeah.
Where's that big car taking you?
Nowhere.
Right? Right? Where are you wearing that jewelry to?
I know.
I mean, if nothing else, this has been a huge awakening.
Yes.
To what is truly important.
Absolutely.
And it's stuff that a lot of us have known all along and for a very long time. It still saddens me terribly that the way that our government has responded to this, and this is not a political statement because it's both sides. We've seen this as a challenge to make a vaccine. Why haven't we seen this as a challenge to be healthier? Why aren't we having those conversations that if people who are overweight or who have heart disease or who have diabetes, which these are all food-related illnesses,
absolutely,
if they're the people that are more vulnerable to this virus, why aren't we having a conversation about how to be healthy?
You're right. There should be a nationwide preventive health care, some kind of a discussion or talk about, like, if you are diabetic, this is a simple things that you can do to protect yourself. Simple diet, lifestyle choices. And I don't know why nobody talks about it. Everybody talks about, vaccine is coming or some other medication. This is not a political or any discussion. This was meant to be a completely different discussion. But and it kind of puzzles me why we, as a country, we're not even talking about preventive health care, from a country level, not at your and my level.
As a country, I can't understand for the life of me why we're having a conversation that is geared around when the vaccine will be available. Now, I'll tell you, there is no one in my family that is going to get that vaccine because I'm not putting more poison in my children. Right? And so, and if I am going to be judged for not vaccinating my children, I'm okay with that. I'll take that judgment because that's the total wrong lesson. The lesson that we need to learn and what we need to be doing. And I'm doing that every day. I am modeling what you should be doing every single day. And listen, I got COVID this week. And I'm on the other side of it. It was, for me, nothing more than a bad cold. But I wouldn't even say it was a bad cold. It was less than that for me. But because I'm someone that's walking my talk every day.
You take care of yourself.
And it's not any easier for me than it is for anyone else. It's just as easy for everyone else to eat whole foods, right? Mostly vegetables. It's just as easy for everyone else to take a walk in nature and make sure that you're moving and start a meditation practice. These aren't things that are expensive. Meditation is nothing more than sitting in a quiet room and doing some deep breathing.
That's right.
So I can tell you that you can't prevent illness. You can't, you're not going to be able to avoid everything. There are toxins, there are this, there are that. We can only do the best that we can do. But I'm telling you that the best we can do is pretty great. You just have to do it. You just have to do it.
That's right.
Yeah. So there's no pill. There's no easy out. And I don't think there should be. I mean, part of the work of life is where we get the joy too. You know, I mean, the
Yeah.
second I get in the woods and take a deep breath, I smile. I'm surrounded by the wonders of nature. You know, I walk up to a tree that has mushrooms growing up it.
Yeah.
And I'm surrounded by the wonders of nature, and it feels really good.
Yes. And as a society, we haven't been, well, we smile, but not with the joy. It's not a smile of joy.
Right.
It's more like a smile of, what we were talking about earlier. The more materialistic, but not the inner joy. That's and inner joy is what you are saying. We have to find that.
Yes. What lights you up?
What lights you up?
You have to find what lights you up.
Yes. Yes.
Yeah.
Beautiful. Absolutely amazing session. Beautiful session.
Thank you.
Yes. And to all the viewers, please, if you have any questions, DM us. We are working with Dr. Jennifer to come up with a group session next year, so that a lot of people can learn from her and start exercising what she's talking about. Anything else you would like to add before we end the session?
I don't think so. Just follow me at Dr. Jen Simmons. I'm posting great stuff all the time. If you or anyone is dealing with breast cancer diagnosis and you want my help, you can go to my website, realhealthmd.com, and there's lots of great resources there for you. And if it makes sense, I can jump on a call with someone and just let them know what I think their next best bet is.
Okay. Well, thank you so much.
My pleasure.
And yes, have a great day and recover. Yes, good recovery.
Thank you. I feel great. I feel great.
Great. Thank you. Thank you so much.
Thank you.
Bye-bye. Bye.
Bye.
Bye-bye.